Hi, I'm Dr. Kritika Mehra, and welcome to the Art of Patient Communication. Recently, I went to Sydney to a digital smile design conference. Now, this company was founded by Dr. Coachman, who had the vision to change patient experience in the field of dentistry. So, as we all know, dentistry takes a backseat. People don't want to see the dentist because of various fears, whether it's a fear of pain, fear of money. They don't want to see them. And Dr. Christian Coachman is actually focused on changing that. There's lots that he wants to change. He does say to the dentist to have a Michelin star grade clinics so patients get good experience. And more than that, what he believes that is that the technology that we have available to us, we should be able to leverage that to give patient a positive experience. How? So, for example, I'll give you an example in dentistry how we can do that. So, we create a 3D structure of the patient's head from the information that we gather from the patient. We would use a CT scan to take the X-ray of the skull of the patient, which gives us the bone structure. Then we do the scanning, which is the intraoral scanner of the mouth, so we get the soft tissue of the mouth and the position of the teeth. And we take photos and videos of the patient. So then all this data gets gathered or layered one over the other. And on the software, we have now a laughing or a talking patient who we can see in a dynamic state. So we can see how much teeth they show and how much teeth we need to make them show in order to give them a good smile. And then we reverse engineer the rest of it. So that's where he has taken the company and dentistry to some degree. So that's the direction where dentistry is going. Whereas what we see in the practices who are not doing that is we would be trying to explain to the patient with our hands that this is your upper teeth and these are your lower teeth. And then we would be moving our hands backwards and forwards to explain them the relationship of the teeth and what sort of damage whatever is causing. Now, in that, some people or some patients catch up to what you are trying to explain, but majority of the patients do not catch up. They are kind of lost because they just don't know what you are talking about because you're still showing things with your hands, and they could be thinking of something completely different to what you're actually saying. And the way that gets proven is usually you would have your receptionist come back to you and said, oh, patient is asking me all these questions. I'm not quite sure. I think they didn't quite understand of what you were saying. And this happens very, very commonly, that the patient doesn't feel that they can actually ask you or ask you to repeat or ask you a question again because they didn't understand what you were explaining. In this scenario, what happens is sometimes they don't end up gaining your trust and they end up going somewhere else. Or they would just say, oh, look, you know what you are doing. Just go ahead and do what needs to be done. And in this case, sometimes if things don't go to the plan, it can fire back because patient will say, oh, look, I just did what you wanted me to do. So instead, how we can improvise this situation is, now imagine having an intraoral scanner. So an intraoral scanner has a wand, which is what takes like multiple images of the patient's mouth, and it's usually attached to a 2021-inch screen. So as we scan the patient's mouth, the images will stitch and appear on the big screen, to which you can actually then use that as a communication tool to explain the patient what exactly is happening. So you can zoom in, zoom out, point to the patient which teeth are, are the problem ones, or which relationship is giving them problem, and how we are going to fix that. That makes sure that the patient and you both are on the same page. So Doesn't matter which profession you are in, whether you are a doctor or a dentist or a physiotherapist, I'm sure the technology has gone to the point where there is something like this available in your sector as well. So it's important to go and explore that and have that in your practice so you could communicate better with your patients. And I understand, I come from a business background. I have a business. My mom and dad were business owners. I'm married to a Gujarati, and if you are from India, you would know how much the bottom line matters to them. And the most objection I get is that, oh, the sleeve of the scanner will cost me X amount because it's disposable and it's an ongoing maintenance, or the scanner will cost number of thousands of dollars. And there is a reluctance in actually buying that piece of equipment for the practice. So, the point that I'm trying to make is that having a piece of technology in your practice adds value in the patient's eyes and they understand the treatment better. If you can show the patient what their condition is on a large screen, which path you are going to take to treat them, and how is the end product going to look like, it is going to give patient a lot more information. In other words, you're actually empowering them with knowledge so they can make better decisions for themselves. In summary, what I'm trying to say is that decision making is easier for the patient when they can see the end product. Decision making is easier when they believe that they can see value. And lastly, decision making is easier when they can trust you, when you are coming across knowledgeable and you can explain them in a better way of what you are trying to say. I think the second point that really stuck out for me at the Digital Smile Design Conference was empowering the patient with their ideal treatment plan. In other words, unbiased treatment plan. Unbiased means that you can actually show the patient what does an ideal treatment plan look like, and what will it look like on them, and what does it mean for them. So when I say unbiased, it actually means that you take your skill level out of the picture. It should not be biased with what you can do, because there's always another clinician who can execute that for the patient if you can't. The second of all, unbiased treatment plan also means your assumptions regarding the patient of their affordability or whether they can undergo the treatment or not, that should be removed from the thought process as well. It's like you have to pretty much think that you are a sales rep at Apple or at Kohl's or wherever, and a client has walked to you and they want an iPhone if you are in an Apple store, or they want a product if you're at the supermarket. And your job is just to walk them where the product is, and they make the choice whether they go iPhone 16 or whether they go iPhone SE. It's their choice, it's their life, they take that call. Your job as a clinician is to lay all the options on the table and empower them with knowledge, and then they choose what fits for them. This is actually called the co-treatment planning model. The co-treatment planning model means that you are actually laying all the ideal treatment plan on the table for the patient, and then patient says to you that this is my budget. Now, this actually takes me to the very important part of empowering the patient, is discussing their budget. We all have a budget and we have to accept that, and so do the patients. So it's important to address the elephant in the room and ask the patient that, look, this is the ideal treatment plan. Are you happy to undergo this treatment? And are you happy to spend this much money? If the patient has a reluctance with either of them, we need to come up with another plan with either reduced cost or different treatment options. And again, in this scenario, if they don't want to undergo a certain treatment, or if it's too extensive for them, we just come up with another option. And if they want to undergo that treatment and you cannot execute it, we must refer the patient to another practitioner who can actually execute that treatment for the patient, because that is in the patient's best interest. And it's also important as a clinician that we take that load off our shoulders, because we do carry a lot of weight on our shoulders sometimes that, oh, I'm not very confident with this procedure. I have promised this to the patient. Will I be able to execute it or not? What if it fails? There's so many sleepless nights. And I think this is when we need to free ourselves by just saying to the patient that, look, I have another specialist around the corner. He's fantastic. I worked with him, or any other clinician, and just refer the patient there. So we all walk away happy. This is what having the best tools in the industry in your practice actually helps you do. It helps you visualize the treatment all the way to the end before you've actually executed it. You can see what the challenges could be on your way to execute them. You can explain the patient, you can warn the patient what could be coming, so they are well prepared, so there are no surprises. To wrap up this podcast, I'd like to say use the best tools in the industry, educate yourself, be aware of your biases, and use ethical practice in your practice so you can add value to your patient's life. And this is when you change from the dentist to my dentist, the doctor to my doctor, or the physiotherapist to my physiotherapist. So, integrating the technology, but still keeping the process humanly is important. That's why I would like to take an opportunity here to ask you to self reflect on your biases when you are doing a consultation with your patient. And are you using the right tools to communicate with your patient? And where could you invest or better yourself in 2025? Thank you for listening. I hope you got something out of it. Follow me on Instagram and do not forget to subscribe to my channel on YouTube. Thank you.